In just a matter of weeks, millions of Americans will either see their health care costs soar, or they can thank Washington for a last-minute solution to a decades-old problem. The problem, what to do with the ACA or Affordable Care Act or Obamacare. Right now, if nothing is done, some of you could see your out-of-pocket costs soar by at least 26%. Scripps News congressional correspondent Nathaniel Reed is live on Capitol Hill, keeping tabs on all of this. And Nate, lawmakers debating this once again today, but they're up against the deadline.
That's right, Del. There was a hearing this morning on a path forward on affordable health care. And look, the panel's chairman and the ranking member, the top Democrat, Bernie Sanders, agreeing that something needs to be done about the affordability of health care.
Status quo is not working. Let's not pretend otherwise.
Well, Mr. Chairman, you and I agree.
We do.
The status quo is not working.
Lawmakers on both sides of the aisle agreed during a Senate hearing Wednesday that something has to change to make health care affordable. But time is rapidly dwindling to reach a bipartisan fix.
We got to have a solution for 3 weeks from now.
At the end of the year, Biden-era subsidies are set to expire for millions of Americans who receive their health care through the Affordable Care Act. According to the nonpartisan Congressional Budget Office, without those subsidies, 4.2 million more Americans will go without health insurance over the next decade. Democrats largely want to extend those subsidies. Some Republican lawmakers support extending the subsidies with changes, but the party in power hasn't agreed on a broader health care plan that could replace the Affordable Care Act. Some, including Senator Bill Cassidy, are proposing a plan that would offer Americans more flexibility in how they use their health savings accounts. With just weeks before the deadline, there's some pessimism that a deal can actually come together. Is there a bipartisan middle ground that could be reached with Republicans?
Always, but it has to start on both sides. And right now, the Republicans are in control.
I think we'll probably have some vote of some kind on probably two dueling provisions. But again, I'm not very optimistic that the Democrats are willing to reform a broken system.
As lawmakers debate a path forward, health care will continue to stay in the spotlight. A Scripps News Talker research poll found 1 in 4 Americans say health care is the most important issue facing the country today. And look, Del, it's not just the substance here, it's also the timing. The timing is of the essence. 2.5 weeks to go before lawmakers are scheduled to leave Washington for their holiday recess. They will not be back until 2026, meaning the issue of finding some sort of extension for those expiring subsidies front and center right now. The problem is it's going to be difficult for lawmakers to reach a comprehensive bipartisan agreement that they will need to reach in order to unlock some sort of some sort of solution to this issue in just the next 2.5 weeks. This is something that they've largely struggled to solve for the last decade or so.
Nate, two questions for you. Is this an example of don't let the perfect be the enemy of the possible? Because they've been trying to repeal and replace Obamacare now for as long as I can remember. What happens if no plan is agreed upon and the subsidies expire?
Well, look, if no plan's agreed upon, those higher prices that you already see at healthcare.gov, those are going to remain in effect, and there's little hope that those prices are going to go down. The toothpaste is out of the tube, so to speak, in terms of the Affordable Care Act renewals. And the numbers that you already see at healthcare.gov on your health care exchange or marketplace, those will remain in effect after this year. Open enrollment ends very early in 2026. And once it does, you'll be locked in on those health care plans. So again, if they don't reach any sort of agreement here, the issue of health care absolutely going to be on the ballot in 2026. Democrats believe that they have a more convincing argument here. Republicans likely going to have to respond to that. Even staunch supporters of President Donald Trump. I just caught up with Congressman Troy Nehls, the Republican from Texas, a staunch supporter of Trump on Capitol Hill, who made clear he believes that 2026 is the time that Republicans will need to focus squarely on addressing the Affordable Care Act and replacing it. Again, a lot of questions about what sort of bipartisan or even partisan compromise could be reached that would have enough support to make it through Congress and to President Trump's desk.
Scripps News congressional reporter Nathaniel Reed for us live on Capitol Hill. Thank you very much.